Geriatric rehabilitation is multifaceted. This course, composed of concise, information-packed presentations based loosely on TED Talks, will examine numerous aspects of rehabilitative care for older persons. We have assembled some of the world's foremost experts on a vast array of topics germane to geriatric rehabilitation. The content ranges from balance to stroke to hip fracture management. The presenters include rehabilitation therapists, researchers, orthopedic surgeons, an exercise physiologist, and a geriatrician. They all share a commitment to and a passion for their topic area, and they have the ability to get their clinically applicable points across in an engaging manner. Prior to each vignette, participants will be asked a question or asked to perform a brief task designed to help you interact with the content so that you will more easily apply the material in your specific healthcare setting. Participate in REG Talk and take home over 15 new treatment ideas for a wide variety of patients. Dr. Lewis's interview with Dr. Eagle demonstrates the kind of cutting-edge content that you'll find in REG Talk. This 1-minute sample embodies the credible, straightforward style of the course instructors.
Weight-bearing considerations, do they differ based on site, age, and device?
Actually, that's a very good question. Following fracture fixation for hip fracture, all patients are made weight-bearing as tolerated. Studies have demonstrated that patients self-regulate their own weight-bearing status. And if we make them non-weight-bearing, it makes it very difficult to mobilize them post-op. So if everybody's made weight-bearing as tolerated, the patient will regulate their own weight-bearing status. And this has been shown to be very, very safe and efficacious.
Now, I do love that you're saying that. However, all over the country, people don't do that. I mean, a lot of orthopedic surgeons have people non-weight bearing. What would be the reason to do that?
They don't understand biomechanics.
Could patients actually injure themselves if they are non-weight bearing?
Well, it's not that they can injure themselves if they're non-weight bearing. They're not going to injure themselves. But it's going to be difficult to mobilize them and get them placed into the appropriate rehabilitation programs if they're made non-weight bearing. It's very difficult to mobilize these patients, and studies have shown that patients getting up and onto a bedpan while lying in bed put as much force across the hip as when they're weight bearing. So we have a saying, if you're going to let your patient take a poop, you might as well let him walk.
REG Talk, Rehabilitation Excellence in Geriatrics. Ideas, research, and clinical techniques worth sharing.